So hello friends, welcome you all to Sail to MDS Dental Academy. I am Dr. Maladia, the pediatric dentist and assistant professor in College of Dental Sciences. So I hope you all are fine and doing great. You are preparing for your examination. You have not lost hope, but you have gained enough strength that yes, definitely I am going to crack this NEET, AIIMS or whatever thing you are working for. So aspirants, I want to talk today about some different thing. Most of time we have uploaded the video that how to prepare for your NEET, AIIMS, government dental exam, how to divide your subjects, how to divide your day, how to divide your time, which book to study, which book not to study. Most of videos are there on my YouTube channel. You can check out the playlist about MDS preparation or NEET MDS preparation. You're going to get it. But today my video is little different. I am going to tell you things you have to avoid during your NEET MDS preparation. Okay, so most of time often people are there to tell you what to do, but there are very few people will tell you this thing you don't have to do. I want to give some small example that let's say you're starting with the learning endodontic root canal therapy. So people will teach you how to do access opening, BMP, how to go for the obturation. But if somebody is add a few points like that, you don't have to use the specific burr. You have to use the safe hand burr while doing access opening. While doing BMP, use your file in brushing motion. Don't use your side wand needles. Okay, avoid excessive force of your irrigation. And what will happen, experience? You will get extra drain. Your mind will get alert. If you are going to do the thing, your mind will stop you. Don't do that thing, otherwise you will land up in mistake, land up in problem. So same thing should be there for your NEET preparation. You know what to do, but you should also know what not to do. So this video is all about that. We are going to have this YouTube premiere lecture. I am there on the live box. We'll have this video in 2 to 3 sections. So I'm going to tell you the points, and I want my all students to imbibe that in the preparation. Fine, so let's get started with the video. So first point, experience, what to avoid. Avoid low thinking. Most of the NEET MDS aspirants, when I'm talking to them, at least every day I used to talk with the 4 to 5 students, and they are telling me, sir, kisi tarah qualify ho jaye. Somehow we get qualified. Sir, we should get at least 400-500 marks. Sir, I just want a MDS at my nearby state or at my nearby home. Why aspirant low thinking? Why you want low? For example, if you want some food is there, some clothes is there, we want the best quality. We'll not take from the adjacent shop or adjacent hotel. We'll go to the best thing. So why not for your life? Why not for your dental? So why don't you want NEET or you want your MDS from the best college? Why are you thinking such low? If you are thinking low that bus qualify hona hai, or you are thinking like that just I should get 400-500 marks, definitely you are not going to get it. There are 3 branches of thinking: high thinking, middle thinking, and the low thinking. If you think at least high, automatically the middle and the low goals will be covered. So always have high thinking, my experience, that definitely I'm going to get in the top 300 of NEET MDS, first thing. And second, I want best dental education. Don't just think qualify ho jaye. Okay, if you think, definitely you're not going to get it. Fine, experience. So first thing to avoid, don't think yourself low, think yourself high. Don't also think that okay, I have done BDS from XY college, so my knowledge is less. No, anything will not matter. Thing will matter how you are doing and what manner you are doing. Okay, aspirants, so first thing to avoid is today go and aim high. You're going to get it like that. Okay, second thing we are going to talk about, I want to talk about the category of student experience. So most often we have experienced 3 category of students. So I'm not trying to offending anybody. So first category is the very rich student, the parents are rich. Second category, middle class, and third is lower middle class. Now I just want to explain you from this category the thinking of the student. With the thinking, how your goal is changing. So first thing, experience, I want to tell you is the very students who are rich, they think that they start for the NEET preparation and they will think, okay, if I'll not get, my father is there, my mother is there, my parents are there, they're going to get me the seat. For they think like that. These students at the end land up in what? getting the management seat. Why? Because their mind is dual right now, aspirants. They are preparing, but at the same way they are thinking that they will get the seat with the help of money. This student will not get the government seat. No chance to get. Second category, middle class. So I am also from the middle class. So we always have the mentality of immediate gaining. People will tell you, you are from the government college BDS, you have learned all the work. Why you are wasting the 3 years in MDS? Let's open the clinic. They will tell you like this. But imagine, aspirants, if with that BDS knowledge you can earn, if I will add the MDS knowledge of 3 years, the earning will not double triple, it will be more and more. Fine, aspirants. Then we have third category of students, that's lower middle class. For them, they don't have the money to open the clinic, and second, they anyhow want MDS in government dental college. So I have few students who are telling me, sir, I cannot pay the fee, but I am assured that I will get the stipend and I am going to pay the fee from that. So what conclusion you can draw from these three category of students? So those students who have dual mind, okay, you have the seat from the management, or we'll open the clinic if we don't get the MDS. But we have another category of student, for them the NEET MDS is their life, is their oxygen, is their water of the life. For them it's like do and die. Karna hai means we are going to get it. And you know, those category of student, for them the NEET MDS is only the one option, they are going to get the seat. So aspirants, those who are preparing for your NEET MDS, prepare wholeheartedly. Have one thing in your mind, that I want to get NEET MDS in government college. Leave all of the thinkings. If you are the thinking, definitely I am telling you, you're not going to get what you want. So please have, if you want to get MDS, have one thinking only. Don't think literally. Otherwise, just don't study and waste your time. Okay. So second thing is what? Think in right direction. Think in one direction only. Definitely you're going to get it. Fine, aspirants. Now, one more thing is that you have to believe in your goal, aspirant. Many of time, what happen when we do the work, we don't believe. We believe that hoga, so okay. But you should believe. Like for example, if you are doing a restoration in a patient, you should believe that the restoration will stay for 5 years. The patient will be able to chew. This restoration will be functional. Then only it will be functional. Otherwise, while doing the restoration, if you are thinking that it will come out or like that, definitely it is going to come out. Why? Because you are not able to give your 100%. Your mind is toward that negative genre only. So aspirants, those who want NEET MDS, believe in yourself that they can achieve this NEET MDS. It is not tough thing. If you give your 100%, you are going to get it. See, if you believe in particular thing that I am going to get it, you know what will happen? Automatically, you will start preparing. You will start, guiding yourself in that direction. And afterwards, if some hurdle will also come, with confidence you will solve that hurdle. So believe that you can crack the NEET MDS, you can be in the top 300 and increase your confidence. Okay, few people telling me, sir, we are feeling very low, we don't have confidence. Why? Because you are not believing that you are going to crack it. You are believing that will it be possible or not, will it not be possible. Fine, aspirant. So what you get from this story? Remember, you have to believe that you can achieve your goal. Fine, aspirant. Then let's come to another category, that is understand the examination. Aspirant, this is your objective examination. Whatever you're giving, NEET, AIIMS, PGI, JIPMER, government dental exam, these are objective exams, aspirant. This is not a subjective exam like a university exam where you are writing 10 marks, 50 mark question. So don't have to study bulky matter. Some students are asking me, for example, if I'm teaching them operative dentistry and endodontics, we have a schedule of around 15 to 20 hours for the subject. Then few students are telling me, sir, 20 years is enough for the subject. Aspirant, remember, you have to complete 21 subjects in 11 months. If you have started immediately after internship, you have 11 months for the preparation. So you don't have a 1 month for a particular subject. I can, in my foundation courses of first, second, third, final year, we are teaching for one subject around 2 to 3 months. We are going to teach them. But same cannot be happen for your NEET, because it's an objective exam. It means what? You should have the proper concept, okay, and second, you should have the important points which is necessary for the exam. If I'm teaching you a small topic for 3 days, or if I'm teaching you one subject for 100 hours, it is just you are getting confused and confused. Okay, even if I'm completing my all the subject within 8 months, and I'm teaching you, I'm giving you the bulkier concept, bulkier topics, do you think you are able to get do the revision? No, you're not going to do the revision, and at the end you are landing up in trouble. Most of the students starting, they want to study more and more, they think that by studying more and more and new things, NEET MDS will be cracked, but they are the stupid students. They are not going to crack it. You have to do the smart work. You have to keep the balance between the MCQ and balance between the theory, and then you are going to get it. Fine. And those students, and then what they do, they will end up in just reading the pulse, and they will be in the 1,000 ranks. So please, I request all my students, understand the NEET exam. It is the objective exam. It is the exam testing your concepts, and we have the newer trends examination. Please, aspirant, those who are telling you to follow the older trends, don't hear them. Okay, you have to study MCQ, you have to study synopsis, you have to study notes, and you have to refer the textbook also at the right area, and that will end up your NEET MDS preparation. Okay, so what you can conclude from this point, that MDS exam, NEET MDS exam is objective, not subjective. So understand the exam pattern before preparing it, and if you're preparing in that manner, try to change yourself. The small story I want to share you. When I was in my final year, we have in our college to read only foreign author books. We hardly touch the Indian author books, very few subjects. So in the final, till final, I was trained in such a way to read textbooks more and more. You are allowed to read the textbook. When I came in the internship, at that time we don't have any coaching or like that, access is not to be there. So I started preparing with the textbook. I used to complete the textbook. So first I studied the oral pathology, and around 1 month I took to complete Schaefer's and Neville, and 15 days for the MCQ. At the end I realized that 45 days are given just for the two subjects, OPATH and OMR, and I think it's not possible to complete in 10 months all the 21 subject. At that time it struck in my mind that I had to keep the balance. I kept my balance and I proceed in that way. I read MCQ, I read notes, and I refer the textbook also, but in reverse fashion, and at the end I got the seat. So aspirants, you have to believe in that manner only. Please understand your exam. Don't go for excessive bulk reading, okay, because revision is utmost important like your preparation. Okay aspirants, so that was about the part 1. We have talked so many things. We have talked about your thinking. Change your thinking. Believe yourself that you can get the NEET MDS. Understand the pattern of examination, and be in that category of student for whom NEET MDS is their life, and then see the change. Try to imbibe these points in your life ready for preparation, and see from tomorrow your thinking, confidence, your remembering capacity, everything is going to change. So aspirants, that was all for the video, and there on the live chat box you can ask me anything what you want. And aspirants, one more thing, we are going with the part 2, in which I am going to discuss what not to study, which book not to study. Okay, students approaching MCQ in the wrong fashion, that all we are going to talk in second part. Till then, keep on working, hand it out. You can tell me. We are going with the new batch for the NEET AIIMS and coming government dental examinations. So anybody want to join lecture series, test series, you all are welcome to get joined. Till then, take care, work hard, and again I'm telling, believe in yourself, don't have little thinkings, and tell yourself that you are in the top 300 of NEET MDS ranking. Take care, aspirants.